Our next speaker, we are privileged to have a physical therapist who is an orthopedic certified specialist. She's also a Canuck, just like Dr. Hawkins, who spoke with us just a minute ago. This is Trudy Messer. She's currently at St. Francis Health System here in the upstate, and she's going to talk to us about how to prevent the need for first aid.
Thank you for coming. I kind of had a blank slate when they said, I want you to talk about injury prevention and first aid together. So I thought, I don't really know where to go with this, so I'm going to put something together and hopefully they like it. So the handouts that you have are my first draft, which was done 4 months ago. So what I would really encourage you to do, everything that's in there is going to be on these slides. I really encourage you to just kind of sit back and listen, because you'll be like going from page to page because I've moved some things around. And then if you've got questions afterwards, I can tell you where it is in your handout, okay? So our objectives, really, I want to talk about overuse injuries. That's what we're really going to focus on today. And then we're going to talk about treatment options. And then since I do predominantly do sports medicine, of course, we're going to go more the recreational and sports injury route. I will talk about some workers' types of injuries as well. Okay, so what is an overuse injury? It's any soft tissue or bony injury that is caused by repetitive trauma. So what repetitive trauma is excessive tissue demand over the course of time. Many times, and certainly in our new ICD-10 that's coming out, it's no longer going to be called an overuse injury. It's going to be cumulative trauma disorder. So forget overuse injury. That's the new term. It refers to a vast array of diagnoses, including occupational, recreational, sport, and habitual activities. So why even talk about injury prevention and overuse injuries? The reason is right there. So if you look at that for a second, we are one of 8 states without a set programmed injury prevention program. That's not good, okay? And so we're all the primary line of defense with that. All of the general practitioners, physical therapists, even our specialists, really all should be working towards getting a really nice set injury prevention program in place. The only state that does have a really good one is Utah. I don't know what they do, but maybe we need to strive to be like Utah. The impact of these injuries vary from occasional annoyance to loss of function as a result of frank tissue destruction. So no mortality, but of course morbidity is very significant. Direct economic impact is big, both for loss of job, loss of sport if it's a professional sport. But the indirect is really what we really need to think about, because it's incalculable for the number of healthcare dollars that people spend coming back for the same injury over and over and over, and we haven't yet figured out that it's repetitive and we just need to fix the cause instead of constantly treating the symptoms. So what are some common overuse injuries? Muscle, of course, we're talking compartment syndrome, soreness, tendons and ligaments, sprain, strange injuries, tendinosis, tendinitis, bones, stress fractures, periostitis, regular fractures, and then bursitis for other soft tissue injuries, and of course that's just to name a few. So the cause, what is the true cause of an overuse injury? Any soft tissue or bony tissue adapts to stress placed on it over time. Common stresses include shears, tension, compression, impingement, vibration, contraction. The result is mechanical fatigue of that soft tissue. So the problem is when the tissues attempt to adapt to the demand, over time, you'll get injury if the adaptation doesn't occur quick enough. And that's what's causing all of our overuse injuries. So mechanical fatigue, not enough time to recover, too short of a time before the next onset of the repetitive strain, then you have your injury. The rate of injury simply exceeds the rate of adaptation or healing of the tissue. Repeated challenge with sufficient recovery time. So those are all the same definitions of the same thing. So the most important factor is the repetition. Although the specific types of force lead to different outcomes. So the greater the force exerted, the greater the likelihood of developing an overuse injury. So our little swimmer here, we're talking about an impingement syndrome of the shoulder. Our little guy here with his 440-pound plates, we're talking stress on the joints way over the amount that the joints can handle. And then we talk about malpositioning of the limbs away from the neutral position. This increases the use for overuse injuries as well. So this is your cumulative trauma disorders of people who sit at a desk all day, your computer workers, your drivers. So it's not just your athletes that are dealing with these overuse injuries. Certain terms that are good to know as physicians when it comes to repetitive traumas are the difference between a cycle and a fundamental cycle. Okay? So the cycle is the large-scale activity that is repeated throughout the day. The fundamental cycle is a small component of that cycle that may be repeated several hundred or thousand times during the performance of that cycle. So a couple of really good examples to give you. In the sports-related world, the best one for you to understand would be baseball or softball. So the cycle would be the inning. The fundamental cycle is how many times that pitcher is throwing in an inning. You know, so if we think about it, that can be 20, 40, 60, depending on the inning. In real world, the best one to think about, and the one that's really mostly impacting us in our computer and lifestyles today, is emailing. BlackBerries, iPods, computers. So the cycle is the email that you answer. The repetition, or the fundamental cycle, is how many times we use those thumbs or how many times we use those wrists in a flex position. So it can be related to any activity you think about during the day, but it's good to understand what the difference between them are, because you want to not only change the frequency of the fundamental cycle, but you also want to change how often the person is doing it as well, which is the general cycle. So if an activity has cycles, they are repeated many times a day, this is considered repetitive. Specialized labor and sports have fewer different tasks per activity. These tasks are repeated more frequently. This repetition is what is causing the overuse injury. So back 30 years ago, when we had kids that were all Americans that played 4 different sports, we didn't have overuse injuries. We didn't have these kids going to orthopedic surgeons every week for another injury. Now that all of our kids are specialized into just soccer, just baseball, just football, they're getting into more cycles. They're getting into more fundamental cycles because they're not varying their activity. Same with people that sit at a desk all day. Everything is done through EMR, electronic medical record. Even our telephones are now through our computers. We have no reason to get away from this position. And that's increasing our cycles and our fundamental cycles. Okay, so let's talk about the culprit and the victim theory, because that's what I really want to talk about today. So the victim is the injured tissue. Mr. Smith comes into you because his elbow's hurting. Yep, it's tennis elbow. I'm going to treat that tennis elbow. We have to get away from doing that. We cannot treat just the tennis elbow. We have to treat the culprit. We have to treat what's causing the tennis elbow. Or Mr. Smith is going to be back 3 months later with the same injury. And once again, we have not prevented any injuries. So we want to focus on the cause, not just the tissue. So what causes can we think about? The first ones are training errors. So sports specialization, which I've already mentioned, participating in one sport and training year-round without modification or variety. This is happening more and more and more every day as we try to make these super elite professional sports people without giving them the ability to let their bodies do something different. And then also no cross training. So as our seasons are becoming longer, baseball season is now year-round, there's no opportunity for them to be not pitching, not hitting the ball, and just training their body in other activities in sports. Other training errors are no conditioning. This is obviously the best example of that, okay? So conditioning is an activity that improves cardiovascular endurance as well as increases the energy capacity of the muscle and muscles exercised. So you're our weekend warriors, okay? You exercise on Saturdays and Sundays and nothing during the week. You're not conditioning your body for those activities. Other training errors, overtraining, too much too soon. So these are all of your runners, all of your triathletes that you may see that come into your clinics with the Achilles tendonitis or the plantar fasciitis or the shoulder pain or whatever. They're doing so much so quickly to try to get themselves to the level that they are good that they're not realizing what they're doing is just mechanically killing their tissues and not giving them time to rest. And then no active recovery. Active recovery is where you perform a less intense exercise during the recovery phase of an aggressive exercise. Okay, so if you're a runner, you run 3 days a week. On your other days, you're not doing just nothing. You're doing a light activity like swimming or cycling lightly to let the rest of the body recover. And then technique errors. So just quickly to touch upon these, I'm not going to get into a lot of detail, but improper techniques. So our swimmers, our daily cyclists, you know, we're trying to be healthier now, we're cycling more. Just normally cycling, not competitively. Well, if we're using incorrect postures and forms, we're going to end up with back problems and neck problems and shoulder problems. Poor fitting equipment. So I had to put this in here because I've just never in my life seen anything like it. But, you know, that is definitely poor fitting equipment. Overuse injuries are more likely to occur with age. That's not rocket science because we have decrease in flexibility and strength and unfortunately an increase in sedentary lifestyle. So how do we find the culprit? The trick is that we all, any healthcare professional touching this person has to evaluate the problem rather than just treating the victim's symptoms and tissues. So the main thing is we need to think about taking a good history. The first and most crucial steps are obtaining a comprehensive information about the onset, the timing, and the frequency of the symptoms. Rather than just saying, yup, that's plantar fasciitis. You got the heel pain in the morning, and it gets better as you start walking, so you better start stretching your calves. We're just mistreating all of these folks because we need to figure out what it came from in the first place. Otherwise, they're going to be back again and again and again, and there's our health dollars going out the window. Taking a good history. We need to get more information about those culprits. That is the key to fixing this issue. With sports-related injuries, we need to make specific attention paid to their training details, their equipment fit, and technique. I'm not up here to ask everyone to become a professional at what cyclists, runners, swimmers, baseball players, whatever, but that's why we work as a team. If you can't do it, there's somebody out there that can. Ask those questions and get those problems fixed. And then for work-related injuries, detail must be paid to prolonged postures and repetitive activities. We used to think we had problems with people that sat at desks. We have no idea what we're in for with all of this new electronic medical record and everything being focused around a computer. At least before, they used to get up to the photocopier to move. That's not even happening anymore. So physical exam, I am not going to go over this. You guys are the professionals that know how to do this. But I just want to put in your handout some things to be thinking about. As far as imaging studies are concerned, diagnosis of most overuse injuries does not require any imaging studies. So often we want to go to an imaging study to find something objective to say that there's something wrong. Listen to them. They're telling you what's causing the problem. They're telling you what the culprit is. That's what we need to fix, okay? If surgical intervention is considered, imaging studies, of course, are vital in the decision-making process. Radiography, again, I'm not up here as a radiologist. I just want to give you something to think about. Bony avulsions, relatively common among people who participate in heavy athletic activity and heavy physical labor. So if you've got a weekend warrior that was out playing with his son throwing a football, chances are he doesn't have an avulsion injury of his greater tuberosity, okay? He probably more likely has a soft tissue injury. You have someone that's throwing a football 140 times in an hour, that's probably someone who could be having an avulsion injury. MRI, of course, the gold standard for most soft tissue injuries. Successful in revealing tendon, ligament, and muscle injuries and can help to assess chronicity of soft tissue injuries. Presence of bone marrow edema on MRI scans may precede visualization of stress fractures. So we know x-rays don't show stress fractures. Sometimes it is helpful to get an MRI if that person's coming back with pain that it is unable to get under control. And then, of course, bone staining, excellent for revealing stress fractures that are not evident with x-rays. So let's get into really what we need to talk about. How are we treating this injury prevention? So treating the victim, like I said, we're going to use our medication, and I'm also going to talk about RICE, just to make sure everybody is on board with what RICE really means. And then most importantly, we need to talk about ways to treat that culprit. Okay, that's patient education. You may not have time to do it, but you probably know someone or can refer to someone for that patient who will have the time to talk to them. So again, I am not a pharmacologist. I'm not up here to talk about medicine, but it's in your handout. Of course, NSAIDs are mainstays for treating overuse injuries when the injury is causing inflammation. Okay? Something food for thought. Again, I'm not going to get into it in detail, but there's a lot of evidence out there that reveals that true inflammation is rarely a component of an overuse injury. So you've got a tendinopathy. So what you have is someone is throwing something, or you've just put your Christmas tree up, and Mrs. Smith comes in with shoulder pain. That's a bursitis or a tendinitis, right? We give her anti-inflammatories. We might put an injection in there, so on and so forth. Her pain goes away, it's okay. Well, what happens is those tissues scar down, shorten, restriction, everything else. Inflammation's no longer there. The next time she has an injury, she comes back, you once again treat just that little bit of inflammation. You haven't treated all of the scarring and everything that's occurred since the last time she had it. So if we're just treating inflammation with NSAIDs, we're really missing the boat as far as treating the problem. Corticosteroids, of course, most commonly used procedure for treatment of overuse injuries. Shoulders, knees, most common. Injection of the involved structure, corticosteroids and local anesthetics. Pain relief enables more effective participation in rehab, and it may help to limit the likelihood that the patient will develop chronic pain syndromes. So there's good reason to use all of these things, but we still can't use them alone. One thing to say about this, the use of local anesthetics and steroids should be reserved for patients with significant pain who have the ability to change their underlying cause. So if all you're doing is injecting them and throwing them out the door, all you're going to be doing 2 months later is injecting them again. You are causing that cycle to occur. We have to think about repeatedly injecting patients that will inevitably return to the same routine, never change that culprit, and always have that injury recurring. Opiates, other medications include muscle relaxers, antidepressants, and sleep-inducing medications if their pain is not allowing them to sleep. Okay, let's talk about RICE. We all know it stands for rest, ice, compression, elevation. It's the most commonly used technique to relieve pain, limit swelling, protect an injured soft tissue. The most important treatment period is the first 2 days after the acute injury. A fibrin clot is formed around the injured tissue, with the body immediately starting to repair the damaged tissue by a scar matrix of very weak fibers. Given the best environment, effective scar tissue formation occurs after 48 hours. Okay? How many times has someone come to you 48 hours within their injury? So we need to be educating these people to doing this, because if they come in 72 hours later and then we give them an injection or we give them NSAIDs, they've already missed the boat as far as the most important time to treat the injury is concerned. Rest is essential for tissue healing. It protects the injured bone, tendon, muscle, ligament, or further injury. The body needs to rest so it has sufficient energy to heal. So remember the mechanical fatigue? We need the time to occur to allow the tissue to heal before we create the mechanical fatigue again. But bed rest is never, ever advisable. There is more literature than you can think out there saying to never advise somebody to have pure bed rest. So what we want to be thinking more about is relative rest. Relative rest from their work, relative rest from their sport, relative rest from their prolonged activity that they might be doing. Now, I highly doubt any of us would be able to tell our children to take relative rest from their BlackBerries and texting. But it's food for thought, because that is relative rest. We've got these kids that are doing this all day long. By the way, these were really cool if you guys got those. I think those are supposed to be like for your thumb, to think about not texting as much, which is really a cool idea. But anyways, we have to be thinking about those things, because kids are texting all day long. They are not going to have CMC joints by the time they're 40. We didn't text when we were there, but we're there now, and how many of us probably are beginning to feel that arthritic change in there? There's our mechanical fatigue happening over and over without our rest. So relative rest is the hallmark of treatment. We have to avoid the culprit, the fundamental cycle, but not total rest of the body. Depending on the severity of the symptoms, this may mean reducing the duration and intensity of activity, so just texting less, Switching to an activity that doesn't strain the injured tissue. So a lot of times with athletes, runners, they want to keep running. What you need to advise them is, I want you to exercise, but I want you to exercise in a pool or on a bike or somewhere where you're not straining the tissues that you've strained with running. Ice, so cold therapy, short-term pain relief. Again, it has to be done within the first 48 hours, so we need to educate these folks. Direct effect on the nerve pain receptors, slowing down the transmission of pain signals from injured area to the central nervous system. Also directly limits swelling, reducing the blood flow to the injured area. Reducing the temperature of the injured tissue by 10 to 15 degrees for short, repeated periods of time will limit secondary hypoxia. Now, I'm not going to go into secondary hypoxia, but basically what we're talking about is cellular death. If we're trying to heal a tissue, why would we do something that created cellular death? So the ice is absolutely essential to be used. Different types of cold therapy to use: cold packs, crushed ice, frozen peas, excellent for $1.29 a pound, or $1.29 a bag at Publix. Ice massage. I'm going to talk about ice massage so you guys kind of think about that because it's often not used. General guidelines for treatment outcomes for ice: never apply ice directly to the skin unless it is moving, which is what ice massage is. Use a thin towel or other protective barrier. Many ice packs that you go and buy today at your drugstore, Walmart, wherever, actually comes with a protective lining with it. And then using repeated rather than continuous ice applications. So when you tell someone to apply ice, they're going to be applying it for 10 to 15 minutes, taking it off, letting the skin temperature warm back up, applying it again, taking it off, applying it again. You never want them to continuously keep that ice on. And then cold compresses, 15 to 20 minutes. Never more than 20 minutes at a time. Best results, first 48 to 72 hours. Now this is great that we all know this. We probably knew it already. You go and sprain an ankle, you're immediately going to apply ice to that. You would be surprised the number of people that their first reaction is to go grab some heat. Very, very surprised. Ice massage, actually the most effective cold method. How to perform it: small styrofoam cup, rip the exposed ice, injured area 8 to 10 minutes, so it takes less time, and you just constantly keep the ice moving, and you want to do it 3 to 5 times a day. Much easier to be compliant because you're wasting less of your day. Time is very important. Compression, controlling the swelling by not allowing the fluid to pool in the spaces between the cells. Fluid pools, we're again dealing with cellular death. We're trying to heal tissues, not create secondary hypoxia. Wraps and compressive elastic bandages can help reduce swelling and reduce movement of the injured tissue, which can provide minor pain relief. So we don't always have to think about a pill as causing the relief of the pain. For the first 48 hours, chances are you're going to have a much better effect with just using compression and ice alone. Guidelines: most times most effective when combined with ice. Wrap a compressive bandage around the area, distal to proximal. It's the only thing you ever have to tell someone to do. If they don't know what distal to proximal is, well, then you might need to give an anatomy lesson, but that's what you want to be thinking about. If it's too tight, loosen it. Elevation of an injury reduces swelling through gravity effect. Guidelines for elevation: most effective when the injured area is raised above the level of the heart. Easy to do if it's a wrist or shoulder. Not easy to do if it's a hip. But there's methods out there to create elevation above the heart, even if it's a hip, that people can learn to do at home. Sleep with the affected area elevated at night if possible. So what about heat? I've already mentioned it. The reason you apply heat to an area is to increase blood flow. Increasing blood flow, increasing more cells to the area that's already inflamed, further creating secondary hypoxia. Okay, so never advise to use heat in an acute situation. Okay, so when applying heat to an injured area, no doubt it'll feel better. That's why everybody does it. But too soon after, what will happen is you'll actually increase more tissue cell death and create more pain in the long run. Once the swelling and pain has subsided, moist heat therapy and light massage can be used to increase the blood flow to help get all those white blood cells and everything else out of the area, but not within that first period of time. okay? After the first 48 hours of an acute injury, range of motion stretching and strengthening are advisable gradually. Stretching can begin after all swelling has subsided. Work the entire range of motion of the injured joint or muscle. Do not force a stretch ever. You have scar tissue that is aligning. Collagen is trying to figure out how to lay it. You put some torque on that, you've just created your mechanical stress again. Stretches should never cause pain. Okay. Patient education. So, final thing to talk about, the culprit. How can you learn to teach your patients about those culprits? It's indispensable. Detailed explanation of diagnosis and treatment programs as possible. Time constraints, we all have time constraints. Utilize other rehab and healthcare professionals to do this. Purpose of education, I'm not going to go into it in detail. Obviously, number one, understanding the difference between just treating the soft tissue injury itself. If they understand it, they'll think about it the next time they go out to do that cycle and fundamental cycle. For sports recreational injuries involving patients who are highly motivated to resume the offending activity as soon as possible, emphasis must be placed on the long-term consequences of returning to those activities too soon. Okay, does not happen in any collegiate sport, I will tell you right now. Physicians do a fantastic job of holding those coaches and kids off as long as they can, but most times we're not doing it long enough. So we think they're doing great because they make it another whole season, and then the season later, guess what? They have another injury. Well, it's because those tissues never had time to heal in the first place. For work-related, patients with probable secondary gain, workers' comp, we deal with it all day long. The physical and psychological complications of lack of activity must be emphasized. So those people who are out of work need not be out of work. They need to be in programs where they're not doing their job, but they're doing relative rest activities to get them moving again. Prevention of overuse activities, injury prevention, decreasing the risk, finding the culprit, correcting the training and technique errors. So, let's talk about training and technique errors for a quick minute before I'm done. Avoid repetition and cross-training. So we've talked about all of these kids that do one sport. Encourage your kids, encourage your patients to diversify what they're doing. Yes, it's good to be great at something, but if you're great at something and you're constantly injuring yourself, there's nothing good about it. Minimize the effects of sports specialization. Pace activities and conditioning. Cross-train, condition your body, avoid weekend warrior stuff, and avoid overtraining too much too soon. Big, big, big problem with runners. They think if I did a mile and I didn't die and my lungs are still working, I should easily be able to do 3 miles next time. Big problem. And then finally, with correct technique, proper form, and correct equipment. So with repetition, as I've already said, a variety of low-impact activities, walking, biking, cycling, swimming, allows the body to use different muscle groups. That's going to allow those other muscle groups time to heal. Again, lengthening that duration, decreasing the muscle fatigue and the mechanical fatigue on the tissues. And then finally, cross-training, 2 or more different activities for physical activity. So triathletes really are brilliant because they're doing 3, right? The big problem with triathletes is they do too much too soon. They overdo it. They don't train well enough. Sport specialization, we need to encourage off seasons, guys. We need to tell people they need to be taking at least 8 to 10 weeks to cross-train and do another activity so their body does not wear out. Those high school collegiate athletes are not going to make it through college and not going to make it to a professional sport without injuries if we don't get them to do this. And then pacing activities. Abrupt new starts, not a good idea. Start slow. Avoid taking on too many activities at one time and adding no more than 1 or 2 new activities per workout. I run a sports medicine clinic that is actually within a local gym. And I love it when I see new members come in. I hate it when I see new members come in for 2 days and then they don't come back for 2 weeks because they're so darn sore because they've done so much too quickly and they've tried to do everything that's there because it's just, it's a smorgasbord of exercise. And that's exactly what they do time and time again. Educate your folks and educate yourselves that a little bit goes a long way. Conditioning, strive for a balanced recreation fitness program, including aerobic exercise, strength training, stretching, core stability, and balance training. Consider the aging effect. Modify the activities to accommodate body's needs. Listen to the body, not the ego. ACSM recommends 2.5 hours of moderate exercise, 1.5 hours of vigorous. Moderate is working in the garden, playing with kids, taking the stairs, not the elevator. Right there, you can get 30 minutes of exercise a day if you work in a multi-level building. Weekend warrior needs to be avoided. We need to encourage people not to compress their activities into their days off. Take 20 minutes during your work day to do your exercise. You have a whole bunch more time during the weekend to do whatever you want. Overtraining, 10% rule. This is really something very important. If you guys take nothing out of this talk today, take the 10% rule. People are always going to come to you. You guys are the pinnacle of advisors when it comes to exercise. Someone comes to you and says, Doc, I want to start running. How do I do it? All you need to think is 10% rule. I remember that Trudy girl said something about a 10% rule. Tell them when they begin their exercise to begin their exercise slowly and only increase 10% at a time. So that might be 10% of the minutes. That might be 10% of the distance. It could be anything. But follow the 10% rule, and I promise you, you are guaranteed you are not going to get an overuse injury. And then overtraining, we need to make sure that people are stretching. So you need to warm up. That is the stretching, warming up. If you're running, you're going to walk for a few minutes. If you're cycling, you're going to cycle slowly for a few minutes. If you're working in your gardening, don't take your heaviest, biggest plants to plant first. Start light. That is your warm-up. And then stretching, we want to make sure that we're stretching the muscles after we've exercised, not before. Stretching before does nothing. The muscle's cold. I mean, think about a piece of metal. If you tried to stretch it, is it going to get anywhere? Mm-mm. Heat that metal up, what happens? It becomes malleable. Our muscles are exactly the same. Flexibility exercises, stretches 30 seconds. That's what the research says. You look at randomized controlled trials, you look at evidence-based practice, tell your people 30-second stretches only, nothing less. And then finally, limiting excessive distance or time. If you are a runner or you have patients that are runners, if they're running more than 45 miles a week, and I know that sounds ridiculous to probably a lot of us in here, but you'd be surprised the distances people are throwing out there. You need to advise them to not be going above 45 miles. Techniques. So if we're starting young, let's give somebody some lessons. Teach them to do it right the first time, and then we don't have to worry about them doing it wrong. We don't have to worry about those soccer coaches when they're elite, because they've learned how to kick the ball correctly. They've learned how to stretch and train the first time around. And then with equipment, if you're starting a new exercise or a new type of physical activity, get advice of the correct gear. Head into Walmart to buy a bicycle because you want to go to and from the park once a week is great. But if your bicycle doesn't fit you, you're going to end up with back pain, and you're going to end up having to come and see me or somebody else because you don't know where this back pain came from. Just all of a sudden started having back pain, and probably is you've probably got a bike that's too big for you or something, or your seat's too high. And then also with shoes, every sport that we do, with maybe the exception of barefoot running now, you wear shoes. So you want to make sure that your shoes are appropriate for your sport or activity. You also want to make sure that you're replacing them regularly. We live in the South. It's humid and it's hot 8 months of the year. Shoes are made out of ethylene vinyl acetate, EVA. It breaks down extremely quickly. So whether you're wearing them, they're breaking down. So just remember that. So if you've got your running shoes that you went and paid $140 for 2 years ago that sit in the closet because you're going to run again, darn it, and they've been sitting there for 2 years, that EVA has broken down. You're going to end up with a plantar fasciitis in 2 runs. Remember that. Go get yourself some new shoes. Encourage folks to have new shoes every 300 miles if they're running or walking or hiking regularly. And that's all, folks. Injury prevention is a lifelong goal. Just remember that. Okay.